Okay, thank you so much for that introduction, and thank you for the invitation. As usual, Celiac Canada puts on a great series of events which are of great benefit to the community and the community at large, including the researchers and clinicians. So I'm going to be talking to you for a few minutes about celiac disease research and why you should be involved. I have been leading celiac research studies for a long time now and really can't stress enough the importance of participation in so many ways, and I'll be going through some of those. So just first quickly, my disclosures. And let's jump in. And so first of all, I'm not going to spend time going through the pathophysiology of celiac disease. It's elegant and complicated, but what I think is important is to recognize that we actually know a lot about celiac disease. And excitingly, from the perspective of the clinicians and patients, we have clinical stage programs, so potential medications that are in the clinic now attacking all of these potential mechanisms. So this is really amazing. This is something that very few diseases, probably none, can really say, that at the very outset, we know enough to target many different things in the disease, and we actually have medicines that are being looked at to target all of these. And so there really is a huge need to have people participate to move these things forward, because we are trying to do so much at the same time in celiac disease, and this is really, gives us so much potential to advance quickly in this field. So just a little bit of background. A lot of this talk will be about potential new therapies in celiac disease and participating around those, but obviously there's a lot of other types of research which I'll talk about. But it has become clear in recent years that gluten exposure is common in people with celiac disease, even when they're trying their best on a gluten-free diet. This was a really great study out of Spain looking at urine gluten levels in people following a gluten-free diet and showing that there really were fairly significant levels of gluten exposure in all age groups, although highest in adults and adolescents. And that this ongoing gluten exposure is associated, not surprisingly, with symptoms and intestinal damage. So there really is a need for more than a gluten-free diet, just on the basis of the fact that a true gluten-free diet is actually impossible. The best anyone can really do is a gluten-restricted diet, which may or may not be enough for all people. We also do know that there's a lot of dissatisfaction with the gluten-free diet. And here are two studies, one out of US and one out of UK, showing that in general, people find the gluten-free diet very burdensome, people with celiac disease, and they are unsatisfied with it. Again, this is across continents, and this data has been replicated in many ways, showing that, again, it is a huge life change, a huge burden for a lot of people with celiac disease to follow a strict gluten-free diet for life. So with that, I think that there is generally an accepted need for things beyond diet, just like we have in other diseases, whether you talk about reflux disease or type 2 diabetes. And all of these, diet is really important, and diet will always be important in celiac disease. But to get really good disease control, you often have to combine this with medications, at least in some patients. So this is a complicated table, but it just shows the pathway of research that goes on for development of new therapies. And this starts with preclinical studies. Drugs are always tested robustly in animal models before they're tested in humans to see if they're doing what we expect them to do without unexpected safety issues. They're then tested in phase 1 studies, which are either in healthy controls or patients with the disease, to just mostly confirm safety. There's a variety of phase 2 studies looking at whether the drug is actually doing what we expect it to do. Finally, phase 3 studies, which are the studies that lead to approval if they're positive. And in most cases, something known as phase 4 studies, which happen after a drug is approved to confirm the findings and figure out more about how they work. And so if you just go down this red column in the middle, we are talking about thousands of patients participating in any one drug program to get a drug from the beginning to the end of approval. But it does proceed in a very methodical manner. At each of these steps, the data is reviewed, it's discussed with regulatory agencies, with clinicians to make sure it's safe and sensible to proceed. But really, to get anything approved for people with celiac disease, it's going to take thousands of patients to participate. So this really is an effort that the whole community needs to be behind if we are going to see these types of advances in celiac disease. So one of the things that I do want to talk about is gluten in research, because this comes up often. Is like, oh, I would never do that, or isn't that dangerous? Or just a lot of really reasonable concerns about gluten exposure in celiac disease. So I just want to give some facts behind it. And this is sort of true for all diseases, where acute damage is not the same as chronic damage. The chronic damage that people get when they're on a gluten-containing diet before they know they have celiac disease for years or decades is not good. The same way that chronic inflammation in the arteries can lead to cardiovascular disease, chronic damage in the intestine can lead to issues and immune problems. But acute damage doesn't do that. And we know this, again, across a number of organs. So this is why if somebody's on a gluten-free diet and they get exposed to gluten accidentally, as happens to everyone, they don't get set back to square one again. People recover from this. There are, as far as we know, no long-term effects of occasional accidental gluten exposure. So acute damage doesn't equal chronic damage, and acute gluten exposure is not the same as chronic gluten exposure. Gluten exposure in a controlled research setting is actually one of the most important research tools we've had, and it's been used for over 70 years, really since the very beginning. It's the reason we know the gluten-free diet works in celiac disease for the majority of patients. Is because of this. And this is something that was done in everybody with celiac disease before the advent of highly accurate serologic tests, as everyone went on and off a gluten-free diet to really prove that their disease was gluten responsive. So in a carefully monitored setting, I think most clinicians are very comfortable with gluten exposure and gluten challenge studies as a safe and reasonable methodology. This is not to say that it doesn't come without some issues, that it can cause symptoms, both GI and non-GI. I think this is obvious to everyone in the audience. It can cause celiac blood tests to be transiently elevated. It can also cause some transient intestinal inflammation, but again, this will return to normal quickly after the study is complete or the gluten exposure stops. But again, gluten exposure in a study will not cause an increased risk of long-term complications. It won't cause permanent damage to the intestine, and it won't cause ongoing symptoms after the study is complete. We actually have fairly good data that most people feel back to normal within a few days of finishing a gluten challenge study, regardless of how symptomatic they are during the study itself. That being said, it is important to always talk to the trial clinician about whether gluten exposure makes sense for you. And it isn't recommended for everyone. If somebody is pregnant or planning to be pregnant in the near future, if you have a severe celiac-related neurologic condition such as gluten ataxia, these are people that we generally do not recommend a gluten challenge or gluten exposure study for. But again, I don't think the goal of this is not to say that everyone should just go and do a gluten challenge study, but I think the reflux of saying I would never do that is maybe what I'm trying to push back against a little bit, and just say that because a study includes some amount of gluten, and all studies work to have the minimum amount of gluten necessary, doesn't necessarily mean it should be the end of the conversation, but it should just be something you look into and understand really the amount of gluten, what it entails, what the monitoring is like, what the trial is set out to prove, and if that makes sense for you to participate in. So there are a lot of celiac research opportunities at this time. Again, I have focused on the ones that are evaluating new therapies for celiac disease, and I have looked on clinicaltrials.gov, and you can see the ones that I was able to find that are active in Canada. This is always changing, so I would encourage you very much to follow closely the celiac organization websites, and sort of including the Canadian Celiac Association, Celiac Canada. They do a great job of updating this and keeping you abreast of research opportunities. The most inclusive, although a little hard to search, is this clinicaltrials.gov. All clinical trials are mandated by law when they're in North America, at least, to be listed on clinicaltrials.gov. But again, it can be a little bit technical. But as you see, there are 4 studies that are active in Canada right now looking at potential therapies for celiac disease. So all exciting, 4 therapies looking at 4 different ways of treating celiac disease potentially, but all very different, different types of studies looking for different types of patients. So there are a lot of opportunities, hopefully one in your area. So I want to just close with hopefully a little bit of a pep talk, and really that celiac disease needs you. We in research, oftentimes you'll hear us talking about a lack of funding or this or that, but really the big thing that slows down celiac research and keeps us from making progress is participation. There is no immune-mediated disorder that has a single accepted treatment. Celiac disease is the only one. It is really an outlier, and we need to move beyond this, really, because in every other part of medicine, we have personalized medicine. We are really moving to an individualized care paradigm where we tailor the therapy to the patient. In celiac disease, we're not there yet, but we can get there. And I think we have great ways to do this in the future. We have new blood tests. We have new ways of understanding why some people are more or less sensitive to gluten, and to tailor therapies for people who need them. We're really desperately in need of research participation. There are many types of studies. Again, I have focused on the studies that are really looking at new therapies, but there's registry studies, there's survey studies, there's all sorts of research studies. And no matter what you participate in, it will help move the field forward. And almost to a person, everyone I worked with, all the patients who have worked with me on over many, many studies, have all felt that the experience has been rewarding. It can be time consuming, it sometimes can be a little bit burdensome. But at the end of the study, almost everyone says they're very glad they did it, that they felt like they really contributed, which they did, to the science. So this is a really exciting time in celiac disease, but we really can't get to where we need to get. We can't make a brighter future for celiac disease without your help. So to go from a favorite author of my kids, only you can control your future, but really only you can control the future of celiac disease. So again, reach out anytime to your celiac organizations, to your local research centers to learn about the celiac research opportunities around you. And I hope you will seriously consider participating and helping us advance the science and care of celiac disease for the future. Thank you again, and hope you are all enjoying the rest of this wonderful conference.